joining me live now in studio, Democratic Congressman Anthony Weiner from New York. Anna, good morning.
Good morning.
Long day for you yesterday.
Not bad, but
Glad
we
you made it up here.
We got something important done.
We did indeed. But I want to get some reaction from you to the sound we just played there. Are you concerned at all that the Republican there from Texas may have hit on something?
Well, the problem is the status quo is unsustainable. The status quo would have us consuming 80% of our GDP in the next 50 years. You know, every single year our health insurance policies get more expensive. More and more people lose insurance. And frankly, more and more of our business gets held down because they have to pay expensive health care costs. So it's not whether we did something, it's just what we did and how quickly we acted. This is going to reduce the deficit in the long term because we contain costs in the bill. It's not a perfect product, and I wanted something different, but it's certainly action where we needed it because we had no choice. Next year, you and I see our health insurance policies go up $1,000 if we do nothing, and sooner or later, your employer, my employer, and employers all over the country are going to stop offering insurance.
Well, we're going to see health insurance premiums and all that. They're going to go up regardless, right? This doesn't take effect until 2013.
That's a very good point. Not only that, all we're talking about is bending that cost curve. We've heard that expression a lot. It's not going to overnight make things less expensive. We're just trying to make it grow a little less. Right now, health insurance policies are growing 3 times the rate of our salaries. So it's eating up all of the productivity that we're gaining, all of the increases in our salaries, and that has to end.
What about Representative John Boehner, of course, no surprise to you, speaking out in opposition against it, but specifically relevant to the fact that people are going to have to buy this required health insurance, and if they don't, they're going to face some kind of penalties, steep ones. Let's take a listen to him.
If you don't want it, you're going to pay a tax. And if you don't pay the tax, listen to this. If you don't pay the tax, you're going to be subject to a fine of up to $250,000 and imprisonment up to 5 years. Now, this is the most unconstitutional thing I've ever seen in my life.
There is a provision in the bill about penalties. Tell us about them.
Well, frankly, it's a little bit absurd. No one's going to go to jail for not paying the penalties. But frankly, here's the reason we do it. The same way all of us get car insurance, all of us are going to have to get health insurance. The reason is very simple. When someone doesn't have health insurance and they go in a hospital emergency room, we pay their bill. And it's simply not fair. You know, right now here in New York City, in my hometown, we pay $6 billion in extra taxes for the uninsured who go into hospital emergency rooms and just pass the bill along to the rest of us. We are trying to strike a balance here. The point is not to sanction people. The point is to make health care affordable for them, give them credit so they'll be able to buy it, and then incentivize employers to also offer it to their employees. The idea is not, I hope that what's going to happen, and CBO agrees, 96% of all Americans are going to get health care as a result of this bill. That's the outcome we want.
What about that one Republican that crossed the line and voted for health care reform? At what point did you find out Louisiana Republican Joseph Gow was going to be doing that? I mean, there were rumblings, certainly.
Well, you know what? We really didn't have much eye on that ball because Boehner and Cantor and the Republicans made it very clear you got to do this without our help. He deserves a lot of credit because he did what was right for Louisiana. He's a Republican, and I hope
New Orleans,
right? That's right, and I hope our candidate beats him. Don't get me wrong, but he deserves a lot of credit for doing that because I think he recognized that for the people of Louisiana who have a high rate of citizens that are uninsured, they're going to benefit from this bill just like all the other states are going to.
Some people on the broadcast today have suggested this was the easy part. And no certainly disrespect to all that you guys had to do, but facing what's ahead, it's November 8th. What is the likelihood that with the holidays and everything coming up, the Senate's going to get their act together, put one bill together that would go right in line with the House, or else you'd be able to compromise and find peace legislation, get it to the President's desk by the end of the year, and get it signed?
Well, the Founding Fathers called the Senate the cooling saucer of our democracy. They've been like a meat locker in recent years, and we make no mistake about it, it's going to be tough getting a bill passed there. But you know, when we passed the Ways and Means Committee, it said, oh, that's just one step. Now we've passed all 5 committees. Now we've passed the floor of the House of Representatives. We've gone much further than when we've been to health care since Medicare was passed 44 years ago. So make no mistake about it, when this is described as a historic vote, it really is, but there's more work to be done. And now we need the President and the Senators to do what we did in the House, make some tough deals, some tough compromises, and get us over the finish line.
What about if it bleeds into 2010, though, midterm election year? That means there's a certain diversion from focus.
Well, I think delay is our enemy. I think that we have to get stuff done. Remember, if you think about it, the President campaigned on this for a 3-year campaign. We've now been working on it for the better part of 9 months. The Senate's been working on it. I want it to it's more important that it be right than fast, but we're at the point now that so many of these issues are out there. We need a strong health care plan with a strong public option. I think the Senators now are going to get a little kick in the pants Democrats in their senatorial chance to move forward now.
Were we to have mic'd you up last night at the vote, would we have heard you yelling and screaming in support as well when 218 was reached?
I certainly was doing that, but I would have hoped you weren't mic'd earlier when we were doing some of the arm twisting. It got a little testy on the floor.
I was trying to get people to spill the beans. You want to do that now? You're going to say no comment.
It's, it's like, what do they say? Lawmaking is like making sausage. You don't want to watch it being made. It was kind of like that.
It's not real pretty sometimes.
Yeah.
Okay, well, Democratic Congressman of New York, Anthony Weiner, thank you.
Thank you.